Okay. And I think we don't live, but I just wanted to try to cover some topics today. Felt a little bit stressed, and I thought, hey, what a great idea to maybe attack some strategies and go through some discussion relating to stress and the different kinds of stress and what stress is. Typically, when we say stress, it's a reference to either psychological stress, physiological stress, emotional stress. But I just want to disambiguate between what so we all have a bit of a baseline. Sometimes we make assumptions about what we all know. There's a lot of advanced knowledge out there. Of course, we've got to start from somewhere. But just like we have, euphoria and dysphoria, EU and DYS, those can have a sort of a positive and a negative connotation. So the prefix EU in front of euphoria makes it a good emotion, let's say, I guess. Even that can, let's not get into the stuck in the weeds here about meaning. The other aspect of this is dysphoria. So when there's an absence of good emotions, let's say. So likewise, stress. Not all stress is alike. If I'm pushing down on my hand, that's creating stress, tension. We could call that resistance. We could call that friction, depending on whatever mechanical pressure or stress is being added on. Likewise, we have eustress and distress. So stress is sort of the parent term, if you like. It's very simple. It's often used. And we can differentiate between eustress and distress. Eustress is the good kind of stress, and distress is the bad kind of stress. So if someone's having a distressing time, if they're able to distinguish between their internal world and their ability to have insight about what their internal world is experiencing, and they're able to articulate what that experience is, then they'll be able to distinguish. If it's a good kind of stress, they're enjoying it. There's a few rabbit holes we can go down here. There's a concept called flow that was pioneered by Mihail Csikszentmihalyi, and he talks about, basically, there's a very famous graph where it's sort of, let's just divide it into three to keep it simple. Either your skill level is low and the task you're performing is too challenging, and that can result in anxiety, and that can be distressing. Then on the other side, I'm going to come to the middle in a second. Then there's an idea of your skill level being too low. Did I already say that one? So skill level too high, and a challenge is too low. Let me strike that. Let's just start from the beginning. Forget all of this. Just do the editing in your mind. As we get better, 1% improvements in my production as we go, and I'll try not to put my foot in my mouth too often. So coming back to Mihail Csikszentmihalyi's concept of flow, the flow state's in the middle. It's coming. Either your skill level is too high and the task is very simple, then that can result in boredom. Then we have the other side where the skill level is too low or lower than the task being performed, and the task is too challenging, too difficult. That can result in anxiety, frustration, and distress. And he talks about this flow channel. Okay, that's kind of, if you want to look at it as the X and Y axis, we have the sort of the flow state that emerges from there. So ideally, I pop up a little graph here to show that, but nonetheless, just imagine it. I think sometimes it's good to exercise those mental muscles and not have everything spoon-fed visually in this era of rich multimedia and animations and bright colors and vivid complexities shown with simplicity. As we say, it doesn't leave anything to the imagination. So in that case, when we're exercising, as frustrating as my explanation might be, think about that in a sense. So on one side, you have skill level is very, very high, and the task becomes very simple. Then we end up with boredom. Okay. On the other end, we have very low threshold our skill level is very low, and the task is very difficult. So that can result, it's too hard for us, and it's too much. So I think, and then the flow state is kind of in the middle. The challenge is just enough to keep you on your toes, and this is where we could call that eustress, I suppose. It's a beneficial type of stress. It's required. It's a part of growth. To develop a sense of growth, there needs to be some challenge. There needs to be some resistance. But if it's too much resistance and it's overwhelming, that can be problematic. And we could have fatigue. We could burn out. We might have cognitive fatigue. We might have physical fatigue. It might just be beyond our capability at that moment to undertake that task with the skill level that we have. All right. So low skill level, high challenge. Yeah, low skill level, high challenge, frustration, distress. High skill level, low challenge, simple, it's too simple, it's boredom. All right. And we want to find this sort of middle path, this what we call the flow channel. All right. When we think about managing stress, there are some ways. I'm just going to pop up some ideas here that I had thought about prior. But the main, there's an old sort of old joke, if you like, about how, the patient will go to the doctor and they'll say, doctor, it hurts when I do this. And the doctor says, okay, well, don't do that anymore. All right. So the first thing is, if there are stressful things in your life, if possible, the simplest scientific rule of, if you like, parsimony, and, look up Occam's razor if you want to delve into that further, is the idea of, it's the simplest thing. Just reduce the amount of stressors. Okay, stressors. In Australia, we just say stresses, but I just need to enunciate that to make sure that it's clear with an ORS at the end. Stressors. So the things that cause stress, the things that we deem or interpret as causing stress, stress-inducing stimuli, then that can be reduced if it's possible, if it's within our means, if it's within our realm of influence, if it's within our sphere of influence, if it's something we can control, reduce that stress. Reduce, if people are stressing you out, reduce your contact, reduce the distance, reduce frequency, reduce the number of people, whatever it might be. Maybe we can talk about spheres of influence and the concept called locus of control in another conversation. Okay. Another one. So just the idea is either reduce or remove the stress-inducing stimuli. All right. The other aspects that might be useful just in terms of physiological stress. If we sort of divide the brain into three parts, just to give you a bit of an explanation, Dan Siegel uses this famous model of having the thumb tucked into the fist, where he models the central nervous system, okay, just the nervous system for simplicity. The nervous system is the spine and the brain. And the brain is a morsel of flesh about yay big. So just imagine that. This is the cortical area, the outside. And then we have the midbrain, all right, in the center there. That's covered. It's sort of in the center of this spherical shape that's got billions of connections. And then you have the brain stem at the back of the head, just behind your ear almost, okay? So using that model of the brain, I'm just going to indicate that on my hand here, thanks to Dan Siegel and his work. But the idea is when there is a perceived threat or danger or risk or a problem of some description, then, and that's usually with our five senses, okay? Our sense of smell, our sense of taste, our hearing, our sight. If we feel something, if we touch something, if there's pressure, temperature, or pain of some description, or perceived pain. If we're thinking about future things or we're thinking about past issues, that could result in a perceived threat in the brain. All right. And so if the brain perceives something to be threatening, it's a threat detection system, let's say. All right. And I use the analogy of like a smoke alarm, let's say, right? As human beings, we may be able to differentiate, for instance, between steam and smoke. Okay. Steam being, liquid vapor, and smoke being from combusted material. All right. A smoke alarm can differentiate that. It knows, if you like, it knows it's inanimate, but it's a mechanism that is able to differentiate if steam is coming out of the boiling kettle, then the alarm doesn't go off. All right. But if someone lights a tissue up in, under the smoke alarm or in its presence, in its surroundings, then the alarm starts blaring. Okay. A smoke detector can differentiate between smoke and steam. The brain doesn't do that unless we train our smoke detector to determine the difference, whether it's the visible difference, whether it's the the olfactory distinction or the smell of something. We know the difference between burnt toast and a burning tire, for instance, right? We know the difference between lovely smelling food that's coming out of the oven, maybe it's wafting through the kitchen, and something that's probably burning in the kitchen, and we might jolt because of the thought, because of the association of what that could potentially mean. We've ruined dinner, or the house is burning down, God forbid. Okay, that sends a message down to the brainstem and activates and sends. For simplicity, again, I'm deliberately being simple. Let's not get caught in the weeds, but just for simplicity's sake, once a threat is perceived, then there is a stress response. Okay, and that stress response could result in, let's say, neuromodulators or neurohormones or neurotransmitters like cortisol and adrenaline, which are sort of typically, and they're not to be vilified. They're protective. They're useful. They have utility. There are functions. So it's not that we want to. They're not bad guys. All right. They're useful. They're helpful. Just at the right time. Okay. If we perceive a threat that we're thinking about, about something that happened 20 years ago in our short lives, and there's nothing we can do about that, today, and our brain perceives that to be happening now. I call that the time traveling brain, and we'll expand on that shortly. Then it's not very useful to have a stress response, because the flow of cortisol and adrenaline is pulsating through our body, and we become physiologically activated. You might know this or may have heard of this as the fight-flight response, sometimes also known as the fight-flight-freeze response, because sometimes we need to mobilize, we need to sort of run and flee, which is the flight response. Sometimes we need to stay and endure and stick it out, and that's sort of the fight response. And blood flow is enabled, blood is thickened, heart rate increases, muscular strength and bands of muscles might increase, and so forth. Breath rate might increase. We might feel jittery. So there's activity, there's action. The body's priming us for activity, whether it's to fight or to flee. Or sometimes it's just so overwhelming we just freeze. What do I do if I see a snake crawling towards me? I'm frozen. I don't know what to. Is it poisonous? Is it venomous? Is it a pet? Is it wild? Is it got a nest somewhere? Is there a tool? How do I have to catch it? And in that thought process, I might just be frozen in that state. But nonetheless, the cascade of the flow of cortisol and adrenaline is already flowing through me. All right. Now, so that usually takes about that's a surge of high energy. All right. Let's think of it as kind of rocket fuel. All right. Normally we have calories that we exert and expend through just basal metabolic rate, which is kind of the the basic levels of energy that we're using on a daily basis just to be alive, just to be breathing, just to be thinking. And there's a whole bunch of involuntary things that the brain and body taking care of, liver function and digestion, converting various chemicals and metabolites in the body. But that's a lot of physiology. I will stay in my lane. But there's a lot of energy that's needed, all right? Excess calories get stored, and we call that fat or adipose tissue. It becomes sort of stored calories. But the idea that I'm trying to get across here is to, I guess, understand that when a physiological arousal, when there's activity, when we've been triggered to respond to a threat, coming back to the stress response, it gives us a surge of energy beyond our usual energy output levels. Okay. In a useful situation, that's helpful. Okay. If it's not in a useful situation, if you're screaming at your windscreen because there's too much traffic on the road, or someone said something upsetting, and you feel social. There's a sense of social threat. That there might be isolation, and it's going to affect my standing with the community, with people. That threat detection system, we need to check it, and there's ways to do that. We'll talk about those shortly. So that physiological arousal of the heart beating, the breath rate increasing, maybe muscular sort of tension. That usually, without doing anything, it will probably take about 10 to 15 minutes, sometimes maybe even 20 minutes for it just to calm down, just to come down to normal. So just a quick tip there, I suppose, is if you're having a discussion with someone that might be of an emotional nature and there's some polarity, there might be a disagreement, or there's a difference of opinion or misunderstanding or misinterpretation or miscommunication, whatever it might be, and you recognize that you've become physiologically aroused, there's activity. From that point on, it's probably not going to be a very useful and fruitful conversation at that point, because there's emotionality. Sure, emotions are important. It's not one. We can't isolate one over the other in terms of being too rational or being too emotional. There's always one or the other. There's sort of married. They're all swirling around basically, and so it's if your judgment becomes cloud and you might say something you might regret, or you might make a decision, or you might give a promise that you might not be able to fulfill, it's probably not a best time. So it might be a good time to just take a break and return to the conversation at a time when it's a better time. So maybe part of stress management, maybe just to have some exit strategies going into certain situations, right? If work is stressful, or if a social gathering is leading towards a distressing situation at a certain point of time, you might have some exit strategies available for yourself. I've got something on at a certain time. I've got to meet someone, and then from the outset, I can meet for an hour and a half, and then I've got this thing that I've got to go to. So I've got to leave by 4:30, whatever it might be. Right? And you say, okay, and time comes, and before it becomes emotionally distressing, you've mitigated that. You've made yourself unavailable. Those are circumstances where there may or may not be actual distressing stimuli. Okay, but if you're able to through a process of what we call metacognition, all right. So cognition are basically thoughts that we have. It's the internal dialogue. It's the internal voice. It's the thinking. It's the language with which we think. All right, and this is usually, say, it might be in a sentence. All right, it might be a sentence like, "Oh, there's too much traffic." Now that might result in a thought that makes me think I'm going to be late to my job, or I'm going to be late to my appointment, or I'm going to, I'm going to be here too long. I don't want to waste time on the road. It's frustrating for whatever reason. So, in those circumstances, it's an important distinction to be able to understand that there's a very strong connection between our cognitions, between what we think about, and the resulting emotions and behaviors. All right. And psychology, being the study of thoughts, feelings, and behaviors, helps with giving this some mechanism. And this is a sort of cognitive model. And if you've done some level of some description of CBT or cognitive behavioral therapy, or any sort of REBT type model, it's an umbrella type modality of treatment and intervention. Metacognition is a skill that can be learned. And what that is being able to tune in, just like I can take my pulse, right? I can have a look and say, all right, what's going on? Let's see. Other than using tools to measure my pulse, to check my heart rate and the speed, we can do that in various ways. We can also figure out and understand and learn about ourselves and what our thought process is, and how our emotions, we can sort of backtrack. Okay, I've become angry. Where did that anger come from? And I can take it a step back and go, okay, what was the thought that led me to that? What was the trigger that caused that thought that resulted in my anger? All right. So someone said something about me, and that hurt my feelings, and I became upset, and that can lead to physiological arousal because I'm angry now, and I might speak in a sort of unbecoming way. It might seem out of character, whatever the case might be. But the point that I'm trying to make here, I suppose, is, in a long-winded way, is that when we are able to scrutinize our thoughts, okay, through this skill of metacognition, when we're able to be critical about our own thinking and assess the level of accuracy, how factual our thoughts have been, the level of correctness, then we can sort of reduce or manage, at least, how active the brain becomes in perceiving that, the likelihood. We can sort of almost give it a probability score, that this is, how likely is this to actually damage me? How much can it sort of hurt me? What's the absolute truth that this person has said something about me that's going to affect me in any particular way? So that can have a reduction kind of effect to dampen and reduce the physiological arousal and the psychological distress that we might experience. All right. So thinking about thinking, learning metacognition, and we might cover these in more and more detail as we go. I want to just give an overview of some general stress management techniques, and if there's any particular ones that you find to be of use, then drop a comment and I'll try to expand on those as we go, and I might just do that as a matter of need. Speaking of physiological arousal, physiology, let's say we talked about increased heart rate, for example, right? So a big thing, it's sometimes the simplest things. An old mentor of mine, actually, sometimes I don't finish my sentences often. Sometimes the simplest things are the most frustrating, but it's frustratingly simple. One of my mentors had said, he said that he was asked a question about, okay, what do we do about mental health? How do we improve this aspect? How do we improve this function? And he said, just exercise and eat well. It's frustratingly simple, he said. So yes, there are a lot of ins and outs in everyone's diet, and exercise routines and movement is going to vary, of course. Personalize that to yourself. But for instance, if someone throws a comment at me, and I'm going to finish with this one, and then I'll talk about something called, it's kind of related to what we call distress tolerance. Excuse me. But exercise is a wonderful stress management technique, and it's preventative. I would say it's medicinal, all right, in the sense that it's therapeutic. It provides comfort in and of itself. It helps circulation. You're pushing your body to a certain threshold, and your heart rate's increasing, your breath rate's increasing. Everyone's got their own level of what that looks like. whether you're pushing weights and doing resistance training or you're doing cardiovascular training, aerobic, anaerobic, all lots of technicalities there, but just exercise, movement in general. Let's just say just simple, going for a walk or being out for a stroll, riding a bike, wherever it might be. It's just keeping it simple. Let's say if someone, just to put this in context and how it can be useful. All right, it's very simple. If someone insults me and I become upset, and it's a legitimate insult, and I feel angry, and that anger results in my physiological arousal. Physiological arousal being higher breath rate, increased heart rate, muscular tension. Okay, let's put numbers on it so it's quantifiable for the purposes of this example, this discussion. Let's say my heart rate in that scenario when I become angry hits 120 beats per minute. Okay, I hit 120 beats per minute, which is almost to sweating point of maybe for myself, and maybe some of you out there might be able to relate to that, but it hits about 120. Had I been exercising, right, if I've been exercising routinely, if I'm fit enough, and I do say interval training, and I jog, for 30 seconds, and then I sprint for 20 seconds, and then I jog for 30 seconds, and then I sprint for 20 seconds. What that's doing is it's increasing my heart rate, slowing down my heart rate. I'm getting puffed out. My lungs are working, my heart's working, circulation's happening. I'm hitting maybe 150, 160 beats per minute, right? Now, when that physiological stress response happens, someone insults me, I become angry. If I'm physically fit, the body sort of, to personify what the body might say, the body sort of says, you know what, this body does interval training. We can hit beats per minute of 160, 170. 120 is not really going to affect me so much. It's tolerable. It's below my threshold. I'm able to do this comfortably. I can take this insultative hit, right? And so it becomes, you've physiologically improved your tolerance to distress, okay, from that angle. So there's a lot of other benefits, of course. You might lose weight, you might feel stronger, you might have a better quality of life. Your chores might become easier. You have less fatigue. It might affect cognitive function and improve that. But just to remain in the context of stress management, exercise and physiological priming of the body can be massively beneficial. As I said, if the body can sustain heartbeat stress, eustress. Let's think of energy as eustress. It's flowing endorphins, getting dopamine hits, and serotonin's coming in, and you're benefiting from all of that. Feels good. It's a good. You're running up a hill and it's challenging, but you overcome that challenge. When you get to that top, you can take a breath and enjoy that. So from that aspect, being able to tolerate extended periods of exercise, everyone's got their own what extended means. If 5 minutes is a long time, extended might mean for doing it for 10 minutes. Someone who runs marathons might say 4 hours is a 4 or 5 hours of a run, of a jog, sort of a fast pace, or of a bit of a jog. That might be an extended period. So if someone can maintain a heart rate of beats per minute, if you like, if someone can maintain a heart rate of 150, 140, 150, and they can peak to about 170, and that's tolerable, even hit 180 depending on your age, a distressing moment when you're thinking about something in the past, or when someone says something, or you're in traffic in the middle of an inescapable situation, when that occurs, even if we are physiologically triggered and there's physiological arousal and a flood of cortisol and adrenaline comes through and activates the increase in heart rate and increase in breath rate, we can tolerate that. It doesn't feel as difficult. It doesn't feel as challenging. It doesn't feel like we might have a meltdown. All right. So those are some of my thoughts about some stress management. So through that, there is some stuff that I might like to mention about distress tolerance. Sometimes Some other strategies, some novel strategies that I might suggest. So we've talked about physical distress tolerance, but I also want to just talk about other ways. So if you find something particularly upsetting or that something that angers you in a particular way, you might deliberately expose yourself to that within measure. Right? You might read a book that you disagree with the premise of. The ideology you're not in congruence with. It's not a part of your value system, and be able to learn to consume that material and tolerate that. Okay, and so that can be something. Watching stand-up comedians, for example, or listening to comedy, or reading jokes that are of insulting nature to things you might hold near and dear, that might be distressing to consume that material. And so you're increasing your tolerance to that. So when someone who's professional is laughing at something that you value and telling jokes, and the audience is a part of the show, and that's something that you revere, when that happens out in the real, because you're doing that in private, presumably, like say you might be reading a book or listening to a show, or you go to a live show, for instance, right? But that's a peak level. You might really get upset. You might get really pissed off at that. If now in real life that thing comes to pass again, and the thing you revere is somehow disrespected or insulted, you've already done the practice. You've exposed yourself to higher levels of being pissed off, and so someone else saying something or alluding to it or being cheeky about it, it's not gonna result in you being eruptive about it in terms, either emotionally or behaviorally. And we can kind of go back and check ourselves in how we're thinking about things. All right. So in summary, we've talked about a few things. We mentioned what stress is. We split stress into two, being stress being at the top, and then we've got eustress and distress, positive stress and negative stress. We talked about Csikszentmihalyi's work on flow. Okay, high skill level and low task challenge result in boredom, and low skill level, high challenge results in frustration. Okay, and we want to be in the middle. We want to kind of be in that middle. There you go. I can use the screen as I just realized I could use the screen as the X and Y axis. All right, but nonetheless, I think you got the idea. You can look it up. Flow. Just do a Google image search on flow channel, and then you'll figure that out, or your search engine of choice. So we've talked about stress, distress, eustress, channel of flow, finding a way to deal with the resistance, understanding that there are stressful things. If we can eliminate or reduce our exposure to stress, we talked about that. Then we mentioned a few things about the mechanisms of how the different parts of the brain can operate, and there's a perception of distress. There's a perception of threat. Pardon me. It's a perception of threat, and that threat might be physical, it might be emotional, it might be social, it might be financial. Look at your bank account and you go, oh gosh, how are we going to get through this? And that could be distressing. It's going to result in there's different ways of thinking about things, sort of what we call cognitive biases or cognitive distortions. Again, maybe another video for that one. Watch this space, or just comment if you want to chime in on any particular aspect. I'm teaching and I'm learning, so this keeps me on my feet. So by all means, make me work. The other aspect is we mentioned physiological arousal, and it's usually about 15 to 20 minutes on the way down. And once we've calmed down, we can re-engage, and we're probably going to be more functional. The forebrain's probably going to be a little bit more composed, and we're not going to be as triggered. We're not going to be in fight, flight, freeze mode, and we'll have a more fruitful discussion potentially. And then we mentioned a couple of strategies about physiological distress tolerance, and also some emotional distress tolerance techniques. If there's anything else, I'll jump back on, and you know what? I feel better having talked about some of these, and I hope you feel better. And I hope that if you do have stress in your life, that you recognize that it's a part of life. We can't remove stress. It's a good function. It has messages. It has a function. It has a purpose. It has a role in our lives. And all these bookmarks that I'll need to note down. These are potential future topics that we can discuss here. I was trying to sort out a live stream, but I've got to get that somehow going. I'm not sure for what reason. There was a function or a feature that I had to activate somehow. Anyway, we've got to learn to be good stress managers, basically, because it's sometimes difficult to eliminate all aspects of stress. And frankly, it would just be boring. Like if you just had a completely stress-free life, you would not have you wouldn't feel purposeful, because there are healthy levels of cortisol, basically, for what it's worth. Because cortisol, we need to stay alert and stay awake. Okay, the changeover between cortisol and melatonin, for example, cortisol comes on during the day when we need to be alive and awake and alert, so that we don't step on an open, a broken glass bottle on our path, or we don't drive into a pedestrian crossing, or we stop at red lights, or we don't. I don't know. We don't do anything dangerous. We're alert. We're able to perceive, reasonable risks and dangers. So a healthy level of cortisol, and there's always going to be some in there. So it's good to manage that in some way. And as the day ends, the cortisol levels come down and melatonin sort of comes up, and that's when we should be at rest. If we're overly stressed, if the cortisol levels kind of overtake and suppress the melatonin, then we're going to be up at night, and that can affect sleep. That can affect the next day. Can affect our functioning at work. Can affect our relationships. So it's an important area, and I think maybe more stress awareness and more self-awareness and more insight can be developed, and not just skills and techniques, but to understand, to do a bit of an accounting and a bit of an audit of those stimuli that result in and induce stress in our lives in some way. I hope that's been beneficial, and I wish you some healthy stress so that you can improve yourself, and I will see you in the next one. Thank you.